Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you doing today?
I'm great. And yourself?
Living it up. Higher
Yay.
than ever.
Wow. Well, that's totally awesome. And we want our listeners to live it up. So this program is about musculoskeletal pain, and you get to call all hour long and speak to Dr. Marc Darrow about what is going on with your musculoskeletal pain or orthopedic pain, which basically means muscle pain, joint pain, tendon pain, ligament pain, disc, back, neck pain, knee, hip, arthritis pain, and any kind of ache or stiff joint that may be orthopedic related, and you just can't put your finger on it, so to speak. Even trigger finger, we talk about that, pardon the pun. So when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And there's 264 scientific studies in this book. The foreword is written by the actor Suzanne Summers, and chock full of information. So if you want to learn all about this, stay with us, but also you'll get the free book when you phone. The number is 866-870-5752. That's 866-870-5752 right here in the studio, and speak directly with Dr. Darrow. Also check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. Very exciting stuff. We are here Saturdays at 10 a.m., again at 1 p.m. if you miss out. And if you're listening at some sort of odd time and you want to just call the office and make an appointment, that number is 800-300-9300. That's 800-300-9300. That's the office. And you can call that number 24/7. And if someone does not answer, they will take your message and call you back. And the number to call us right now is 866-870-5752. And call now while lines are open for you, because, always at the end of the program, Dr. Darrow, we get like tons of calls and then we run out of time. So call early in the program. What do you think?
I think I'm going to take questions like I do till we get some callers. So let me see what I've got here. So as you folks who know me understand, I do emails in between patients all day. When I wake up in the morning, right before I go to sleep, when I get home from the office, I'm an email junkie, and I get emails. It is kind of addictive, actually. I get emails from all over the world, from young people, from middle people, from older people, about their musculoskeletal pain. And just to let you know, I don't treat diseases. I just treat orthopedic issues, meaning the joints, ligaments, tendons, people that have pain around their body. And it's been a great run for the last, I've been doing this work for over 22 years. And I was lucky enough to been healed by it myself, which made me a believer in it, and then start doing it on other patients. In the beginning, it was kind of testy. I would say, I've tried this new thing on me, and would you like to try it? And they go, well, I don't want surgery, so yeah, I would like to try it. And then it became something that has pretty much taken over the entire planet right now. I've been teaching this at UCLA since I finished my residency there back in, my God, when was it? At the end of the 90s sometime. So it's been going on 22 years, and I've been teaching at UCLA all the time. I have a lot of residents that come to stay with me. They do a rotation with me. Medical students, I have many of those, and even college students and a few high school students that study with me. And we get occasional doctors from all over the world that want to do this work that stay with me and study with me also. So it's something I've really enjoyed. It's been a great life work, and hopefully I will do this till the day that I vanish from the planet, however that'll be. And I really enjoy it. There's nothing else I would rather do because the results of success are so high. And we do it with such simple, natural things. I'll take a question here that'll get us going. Okay. This email came in. It says, knees, fat versus bone marrow. So let me see what that says. I have been told that body fat is superior to bone marrow for harvesting stem cells for treatment of knees. Your comments, please. So what this is about is what we call regenerative medicine, meaning that we stimulate the body to grow back tissue. And that in a joint may be the cartilage. If it's a knee, it may be the anterior cruciate ligament, the ACL. It can be the medial collateral ligament in the knee. It can be the lateral collateral ligament. It can be the meniscus. All these things can be stimulated to grow more tissue. And back in the old days, I used to use dextrose, which is sugar water, and we called it an osmotic shock agent. It would kill a layer of cells, create inflammation, and sequester or bring fibroblasts, which are cells that grow collagen, to the area of the injection. And even back in those days, using dextrose, which is very weak compared to what we use today, things like PRP, which is platelet-rich plasma, or stem cells, which we could get from body fat or from bone marrow, and there are other ways to do it also, but this question addresses body fat versus bone marrow. And I can just tell you my history. I can't tell you, I'm not God. I'm not speaking about the ultimates, but I'm just saying what my experience is. I started out using fat to gain stem cells, and then after that I used bone marrow. And what I find is it's a lot easier to use bone marrow, although the idea of doing it was something I didn't want to do right away. Fat seemed to be easier, and a lot of guys who say fat is better are guys who don't want to do bone marrow, because with fat you make a little incision, usually in the belly, and then you put in a trocar, which is about 10 or 12 inches long, and you beat up the fat. So it's easy for a practitioner to do that, but it's kind of hard on the patient. It's a little lipoaspiration. It's a little liposuction. Don't worry, it doesn't get rid of cosmetic issues, so it's not going to make you look skinnier. It's just a small amount. But fat is very dense, so we have to beat it up to get rid of it and to get it out. And I didn't find that was good for the patient. A lot of people would get black and blue, and it was a more invasive procedure than doing bone marrow. Bone marrow takes me literally, once I numb up the area on the back of the pelvis called the PSIS, the posterior superior iliac spine. Once I numb that up, it takes me about 15 seconds to do the procedure. To put the needle in takes about 3 seconds, and then to aspirate the bone marrow, we don't need a lot of it, takes about 10 seconds or so. So it's a very discreet, easy procedure to do. I prefer it. My patients prefer it. And which one is superior in terms of healing? I didn't find that the fat worked as well as the bone marrow. Now, there are other guys that will tell you the opposite. So, every doctor has different type of successes in different areas. My experience is bone marrow is easier to do, easier on the patient, and much better success rates than using fat. Okay, so that's the answer to that question. And what I want to do now is give out our phone number to the studio and to my office. The studio number right here where you can talk to me live is 866 866-870-5752. That's 866-870-5752. Please call me now, because towards the end of the show, when everybody seems to call, I can't get to you. And then it's unfortunate that you'll miss out a chance of having to be able to ask me your own questions. And if you don't want to give out your name, give out a pseudonym. It's easy to talk to me. I'm nice, I'm kind, and I want to help you. And if you don't get to me on the show, you can always try to catch me at the office. And if we didn't cover everything you want to know, the office phone number is 800-300-9300. That's 800-300-9300. And we'll be glad to answer your questions there also. And we have people by the phones right now at the office and at the studio. So you can call the studio right now, talk to me live, 866-870-5752.
Sounds good.
I see we have somebody calling in since I gave out the phone number.
Well, until that, I want to say something.
Sure.
Because when you call the program today, you get Dr. Darrow's latest book for free. It is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it has 264 scientific studies. And over the 12 years that we've been here together, and you've done the show, of course, way longer than that, about 22 years, we have had many people say, well, where's the science? And I don't understand. Well, I haven't heard this before. Well, here it is. Here's the science for you. So all you have to do is call 866-870-5752 right here in the studio and talk to Dr. Darrow, ask your questions, and get your free book.
Let's go to this caller. It doesn't say a name or an issue, but I assume...
here it is. It's Bruce. Let's go to Bruce in Los Angeles.
Oh, a question on testosterone. Okay, well, that's not directly musculoskeletal, but it often can be related, so I'll take it. So, Bruce, what's your question about testosterone?
Well, my question is, I think I heard you happen to mention that you use that. And
only since I'm in my mid-40s, and I'm 72 now. So it's more than a minute, yeah.
And what does it do for you?
Number one, it keeps you very fit in many ways, musculoskeletal-wise, obviously. It keeps your bones dense. As we lose our testosterone, we get osteoporosis, men and women, same way. And unfortunately, doctors only deal, for the most part, with female osteoporosis, but men get it the same way. Ours starts a little bit later than women, because as soon as women start losing their testosterone, it's much younger than men. It can be when they have a baby. Sometimes they lose it when they get married. You know, that drive to go on the hunt to become a partner and have babies is over. So they lose their testosterone then. Men start losing it after the age of 30. By the time they're 50, it's way down. In their 60s and 70s, there's not much left. And even though your doctor will do a testosterone test and say you're in the normal level, that's the normal level for a 90-year-old. And if you look at a bell curve, that'll show you that a lot of people are in the normal level, but it's in the normal level for an old guy or an old woman. And we want to be young. So, you know, people call this anti-aging medicine. It's not really anti-aging. You're still going to age, but you're going to do it very gracefully. You're going to have more muscle, less fat. Brain power is accelerated. You feel great. My belief is the number one reason for depression in our country is a lack of testosterone. And we find that when we give testosterone to men and women, they become much happier. Their libido increases. Their sexual, well, I don't know what a good word is, Nita. What's the word without saying something nasty?
Well,
abilities.
Well, if you want to be sexually active, then
you need testosterone. It's
yeah.
the way it is. Now, the funny thing is, Bruce, men need estrogen and women need testosterone. Now, we don't have to supplement estrogen with men, because if their testosterone level is high enough, in what I call the upper normal level, they're going to have enough estrogen also, because the pathway from testosterone goes to DHT, which is dihydrotestosterone, and on the other side, with aromatase, a way that the body will generate estrogen, it also can go to estrogen. So the problem is, if men take too much testosterone, they get too much dihydrotestosterone and too much estrogen. So bodybuilders really run up the wrong tree with what they're doing. They don't do it properly. They don't watch the hormone levels in the blood, and they cause problems. They get galactorrhea, which is milk coming out of the nipples, and extra breast tissue. So a part of them becomes female. So they have surgery to do that. That's not a good way to supplement testosterone. So tell me what other questions you have, Bruce.
Has this changed? Is it any different than it was 20 years ago?
Yes, it's very different in the sense that we know much more about it. I did a 2-year fellowship after medical school, after my residency, 2 extra years in studying hormones. Okay? It's very complex. When bodybuilders do it, that's the old way. It's just shoot it up. They were not watching what's healthy. Today we watch what's healthy. We don't use stacking techniques where we put different testosterones on top of each other that allow us to work out like maniacs and not have any pain. We do it the natural way in small doses to keep the body at a level that it was a few years ago, not to jack it up to the sky. So that's the new medicine on it, and watching the hormones constantly. Okay?
And are you doing it orally?
No, doing it orally is terrible for the liver. The best way to do it is
an injection.
For men. For women, the best
Yeah.
way is a cream. Yeah, because women only have a very small dose, like 2 milligrams, and men will inject like 100 milligrams once a week or something like that to keep the levels stable. Now, let me ask you a question. Since you're talking about testosterone, do you work out?
Oh yeah, I've listened to you a lot. I'd say our lifestyles are similar.
Okay, good. So do you have any pain in your body? Any of your
Not
joints
really.
hurt?
But
Okay.
hey, I'm listening to you, and I heard you say this, and I just thought I'd ask about it.
Yeah. No, it's a great way to stay fit, and there's nothing illegal about it the way we do it. Doing it as a bodybuilder is illegal. We're not allowed to treat it for bodybuilding purposes.
Why do you suppose more people aren't doing it?
There is an old wives' tale that it causes prostate cancer, just like there's an old wives' tale that estrogen causes breast cancer.
Uh-huh.
When you pull those studies apart, they're false. The Women's Health Initiative came out, I think it was 2002, saying that estrogen causes breast cancer. That's been torn apart. Their statistics were all off. So most doctors do not want to give testosterone to men or women. I give it to everybody if they need it. But when I say if they need it, I check their blood levels first. I don't just rampantly give it to anybody. Make sense?
But you did say that, well, need it. Most people go, conventional wisdom has been like from a 90-year-old man. So really, most everyone could.
No, I have found men in their 20s who need it.
Sure.
Testicular function can be set off, dysfunction, I should say, can be set off by a quick kick there, by mumps, measles, other things like that. And I've had men in their 20s with testosterone levels of a woman with osteoporosis, men that young with osteoporosis. So it can be any age that it can be a problem for. Anyway, I'm going to move on, Bruce. I'm going to talk about musculoskeletal issues, which is what the show is about. But God bless you and thank you for your input and your question.
Yeah,
so I'm
going
to start off right here, Nita, with giving out the phone number again.
All righty.
To the studio so people can talk to me. It's 866-870-5752. I'll repeat it for you. Grab your pen. 866-870-5752. I would love to talk to you. And if you miss this and you get to my office phone number, that is 800-300-9300. So we have another caller coming in. Until then, I want to take a question. This one says neck, back, knee pain. Well, that's a lot of stuff. Poor person. The email itself just says make an appointment for knee, neck, and back pain. So I'll talk generally about those. Anita, you can cut me off as you watch for these callers coming
Yeah, we're
in.
getting one right now. I'll let you know.
Okay. So I already mentioned the knee. There's many structures in the knee that we use platelets, PRP for, and if it's advanced arthritis or something like that, I'm going to use stem cells. Neck and back are really the same thing. I've injected both my knees with stem cells with amazing success. I injured my right knee about a year ago from overuse, too much running and too much playing golf and blah, blah, blah. And it got to a point where I literally had to limp. And after a golf game, I had to limp off the course, drove down to my office, put my ultrasound on it to take a look inside, and I had a giant effusion. That means fluid in there, and it freaked me out. And I aspirated the fluid out. I had about 35 cc's of fluid, and I put in stem cells. I did that 4 times in 1 week because the fluid came back and I was still having pain. And today I am back to sprinting, playing golf, and everything else. It healed up very, very quickly. So I am really the testament for this kind of work using stem cells and platelets. I've injected both my knees, both my shoulders, what else? My elbows, my right wrist. I've had other doctors inject my neck and back because I can't reach back there. But it's worked on me every time.
That's terrible that you can't reach back there. That's terrible.
I mean, I could, but it's a little bit dangerous.
You might miss.
To inject. Yeah, I might miss. I do have friends who have injected their own necks and backs using a mirror, but I don't like doing that. I'm not that savvy on it. So I have other guys do it for me.
Okay, and we do have Jay, by the way.
Okay, let's do Jay. Jay, you have a question about supplements. Hit me with it. What's up?
Yeah, the question was on 19-Nor. It's a noranstendione.
Say that slower. I didn't catch what you're saying. What is that?
I'm sorry?
I didn't understand. I'm sorry.
It's a supplement. I used to buy the supplement. They told me it was banned. I guess.
Are you talking about androstenedione?
Yeah, Nor.
Yeah, that's gone.
Nor,
yeah, that's gone because it metabolizes to testosterone. So, the big story on that one was Barry Bonds, who gained 30 pounds of muscle over one summer or something like that.
Right, but it wasn't steroids. It was a hormone.
It's a steroid. No, it's a steroid. They're all steroids.
Really?
Yeah.
I thought that
O-N-E. Yeah, O-N-E at the end of it means steroid. So androstenedione, testosterone, progesterone, they're all steroids. But we think of steroids as abuse of testosterone.
My understanding is actually missing a molecule, the 19-Nor, and I don't know, I was taking it for a number of years on a cycle. I found it very effective.
Of course you found it effective because it metabolizes testosterone. I just gave you the answer. It's illegal now because it's not there. Yeah, well you could take, I get it, you could take enough DHEA and get the same effect. Okay? Because it metabolizes testosterone. Just you have to take a barrel full every day to do it.
Okay, stand by, Jay. We have to go to a quick break here on Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.